This is an overview of Prepare Medical. This is a new company that's popped up in Canada, and this is a company that allows you to online order directly from a pharmacy with their own kind of built-in physician assessment, a medication kit for an emergency. So it's really designed for like if you couldn't get access to a doctor and you needed drugs in an urgent fashion, then you would have a bunch of prescription drugs and some over-the-counter drugs and some guidance of how to use them if you can't get a hold of a doctor. That's really kind of the purpose of this kit. So I see this as great benefit for like those traveling internationally. That's kind of like the big highlight for myself. And there seems to be a big interest in kind of like just a preparation aspect of, you know, systems are down, you can't get to a doctor, snowstorm sort of thing, you could have it at your house. Definitely there are some cautions here. So personally, my name's Ken. I'm the owner of Wild Med Kits, and I am a registered nurse. That's my professional background. So I want to take a look at some of these drugs and kind of talk about my thoughts around using it as a nurse. Obviously, I'm not a physician, but I think I have a good background to talk to those that are the general kind of lay person this is guided for. So when you buy this kit, there's a couple ways to do it. We'll take a look at the website here. So here's the website. Let's see if I can zoom in here. Perfect. Okay, so there's the website there. When you go to their website, there's a couple ways you can order this kit. You can either do cash, which means you're going to pay for it. So you can just literally put in your credit card information and pay money, or you can do it through insurance, and it will assess your insurance and it may adjust some of the medications based on your coverage. So when we take a look at the medications I have here, because is the kit that I ordered it through my insurance. So some of the medications are slightly different than what they list as the cash. So I think if you're going to be more, inclined about specific drugs you want, you might want to go more the cash route, because you're going to be able to pick and choose a little bit, more specifically, because they will definitely leave some out if your insurance doesn't cover it. So we're going to look at kit by kit here. First thing I wanted to actually look at before we get into the drugs is this comes with this booklet. I think it's a pretty well done booklet. So here's the book here. Inside, it kind of gives you a little overview of everything. So let's just see. Right in the front, it gives you their copyright information there. And it has some warnings. It has all the drugs that could be in your kit listed by what they call their kit types. Then it has all the drugs alphabetically and then the page numbers that's on. And it lists some general reasons you would take them. So that's kind of a nice, easy to, access kind of indexing for the medications. And then it goes through the conditions that you might come in contact with and lists some drugs you might use for it. So that's kind of I think it's a good little educational guide. It goes through a lot of stuff in here. Some bites, some scans, some soft issue. Yeah, it's got a lot of stuff. I think that's a pretty nice little overview of information. So it goes through each of those sections there. And then when you get back to medication information, obviously they have a disclaimer here. I think that is really good to read because, some of this medication, you really got to have some understanding behind taking it, because there are definitely some side effects and risks, particularly if you're on other medications and mixing it. So that's my hesitation, particularly with some of these for sure. And, using them incorrectly may have some side effects that you were not wanting and could cause some harm. So that is definitely a bit of a caution with this type of thing. But like I said, in certain use cases, I do see some interesting benefits to it. So again, it goes through the different kits and the medications, talks about expiry dates, how to administer, some common side effects, and then it goes through each drug. So each drug has kind of their listing here, how to take it, and then some add-on medications. So there's extra meds in here as well. There you go. So that's the whole book. In the back, we have an appendix, and it goes through storaging, medications, expiration, safe disposal, and major red flags. So that's I think that's a really good page to look at, is when are we beyond the ability to kind of treat ourselves and we've really got to go? Those are really good ones to take a read through. And it's got some note sections at the back. So I think the inclusion of that book is really nice. And that's kind of a good benefit to it. You also do get a bag. So here's the bag you get. It's got kind of 2 zipper compartments. This one just kind of big one here that's fairly flat. It's not super thick, but you could definitely fit a few things in there, particularly if you take them out of the box. And then in the main section here, you get 2 of these like Velcro mesh sections. And that does expand to be, I'd say about 2 inches thick. So you could probably store the vast majority of meds you get in this kit in here, or kind of add your own. So what I want to do is break down these kits. So let's take a look here. So first of all, you have the Essentials kit. So if you're buying this cash, they say it's $350. And the medications you're getting is antibiotics. I think, honestly, this is kind of the makeup of what people are looking for. You know, you're traveling, you get some sort of infection, and you can't get to a doctor easily. It's managing it until you get home. I think that's where people see the greatest benefit. So I think this is an interesting little kit to get. There's my name, obviously. So these are all prescribed to you. You get enough to complete that full kind of course of antibiotics. And I see the benefit in that. You know, they've got some pretty good broad spectrum antibiotics here. They give you some good use cases for it. You know, obviously with antibiotics, you have to be careful not to overuse them because you can cause more harm. So that's definitely a big thing to think about with it. But I think that's definitely an interesting aspect. You know, $350, if you were to compare that to trying to get to a doctor, perhaps in some of these places in the world and the challenges associated with it, if you didn't have insurance coverage for travel, the cost could be astronomical, you know, particularly around like a cruise or something like that. So, you know, I don't think the price is crazy for the potential coverage you might get. The other thing I think about is maybe like expeditions. So if I'm doing a big wilderness trip where there's just no way for me to get out, you know, I'm out there for a long time, this might be a good coverage for it. So I kind of think that's a basis of this whole thing. Obviously they call it the essential kit for that reason. So that would be the main one I would look at. So I think that's pretty reasonable. Then as you scroll down here, they give you some extra options here. So the next one is travel. Now, when I got my kit, I didn't get all the drugs listed. I only got 2 medications in here. And one was the malaria medication. And then the other one was just for nausea. And it's a prescription med for nausea. I personally never heard of it before looking it up. I don't know if I would really need that. You know, I think sticking to like, you know, my Gravol and other things would be much better, but they sent that and it's not even listed on the medications they have here. So that's interesting. And the malaria med is really specific if I'm going to like a malaria zone. So I don't know. I would say that travel one would make sense if you think you're traveling to an area that has, you know, the malaria aspect of it. You can also go to a travel clinic, you know, and probably get that prescribed pretty easily, maybe for less cost. The other ones in here, naloxone, we can get for free in Ontario. The Florister is a probiotic. They're obviously expensive, but, you know, you could buy that. Bismuth salicate is Pepto-Bismol, so you can get that over the counter. Electrolyte powders, you can get over the counter, you know, under the brand name Hydrolyte, or there's many other brand names for that. And it wasn't included in my kit, actually. Neither was the Pepto, or the probiotic, which I think honestly would have been nicer. Diamond hydrogenates your Gravol. So I think that's a great medication to get. But again, you can buy those over the counter. So I don't know. I think the travel category, I personally would probably have skipped that one, you know, looking back at, particularly if I had to pay cash for this. And also when you're thinking about your insurance, you got to think about your coverage over time. So it didn't tell me how much it was charging my insurance company. I just put in the insurance info, it said approved, and then it sent me what it sent me. So you have to be cautious how much you're going to burn all your insurance on this, like, maybe you'll never use kit. So I might be cautious around some of those add-ons. I think the essential, okay, travel, I think you could probably look at this and get a bunch of these at your local pharmacy. And if you needed specific things like malaria, you know, visit a travel clinic. There's tons all across Canada, and their physicians will probably prescribe that stuff. I think a lot of pharmacies are doing it too. And I don't know if the cost would be that high, and they might be more specific guided to exactly where you're going. The next category is allergies. This is an extra $400, not a cheap category by far. And I'll show you the kit I got. So here's the allergy kit I got. I think there's some interesting ones in here and some ones that, I don't know, you know, maybe. So it gave me cetirizine. That's, you know, Reactin. You can buy that over the counter. I don't think you need to really pay for that. fluticasone or Flonase. This is a nasal spray. This is really good. It got like, runny nose, really bad, like kind of seasonal allergy stuff. I'm pretty sure you can buy this over the counter now. If not, you can buy at least something close to it. So again, I don't know. Amicinaride or whatever it is. This is just like a topical like anti-itch cream. It's a prescription one. It says reasonably like not crazy dosage here, but you could buy hydrocortisone or cortisol cream over the counter. So, Olapidine, again, this is a symptom management. This is an eye drop. So for like itchy eyes, that kind of thing, you can buy eye drops over the counter. So I don't know about that one either. And then the main one's the EpiPen here. So from my understanding, and you'll have to check with your local pharmacies, you don't need a prescription to purchase an EpiPen. You can purchase them at a pharmacy. They're generally around $120, $150. So that would be, just under half of what they're charging for this package. This is the adult dose, the 0.3 milligrams. You can get a kid version as well. And honestly, I think if you're going to carry this, carrying 2 would be preferable, particularly for the use cases I talked about, expedition medicine, international travel. You may need 2 doses. So I don't know. I think this kit, I probably wouldn't get this one personally. I would personally purchase 2 EpiPens. I think that's better. And then buy my Reactant over the counter, some sort of eye drop over the counter, some sort of anti-itch cream over the counter, and maybe the Flonase. But that's not something that's going to astronomically bother me personally. But I think you could get something similar to that. So that might be an aspect of the kit that I don't necessarily invest in, particularly for the $400 here. So let me just zoom back in here. There you go. So that's the allergy kit. And yeah, they gave me everything on that list. The next one's women's health. So for this one here, just so you know, you can only order this if you are biologically identified as a female. I think that's a missed opportunity. Now, for me as a nurse, I would think about perhaps having this kit for me and my family, or even like close friends I was traveling with. That may not be the use case intended for this kit, but it's just a thought. So I think this one would have been really good. You're getting some antibiotics specific to UTI, which is really common. They even have a UTI test strip, which is pretty cool. You have some antifungals. So that's your clotrimazole cream and fluconazole. And then there's your antibiotic. The fosfomycin thing, I've never used that before. That's something interesting there. I think this actually would be a really useful one. So this is something I would have liked to purchase, but I couldn't because I am not biologically a female. But I think this would have been a really helpful one for travel. So, if you're trying to get this for your family going internationally, you might have to get the female participant in your group to order this specific section. And I don't know. Oh yeah, it looks like you can on-click the essentials. No, you cannot. Interesting. So it looks like you would have to buy the essentials to get that. So just so you know, I think that'd be a really useful one. They included a bunch of other antibiotics in the general. I think that would have been a good one to have. And the antifungals are good. Although, to be fair, you can buy this one and this one over the counter. UTI test strips, I'm not sure if you can buy those over the counter or not, but that'd be interesting. Then we come to viruses. For $200, outside of very specific use cases, I don't think this is a good idea. This is the virus kit that was sent to me. So they only list 2 medications on the website. And then when I got my kit, I got 3. So this is a cream for herpes. That's a pill for herpes. Or shingles is the other kind of common thing you're looking at for those. And this is Tamiflu. So this is for like a viral influenza. I don't know. Honestly, this is not something I would have purchased in and of myself. I don't think I really see a massive need for this personally. But it's, I guess, an option. It would just be one I'd maybe have some hesitation spending the money on because I don't know how useful that would be to everybody. Then the last category they have here is symptoms. So let's take a look at symptoms here. So this is an extra $400. So definitely not a cheap add-on. And I'll show you the kits I got, but there's a list here. So let's go through it. So A cream for anti-itch kind of stuff. You could get something like that over the counter. There's an antibiotic cream. Loperamide is for diarrhea. Senosize for constipation. Ciprofloxacin. This is really good for like an ear infection. So that's an antibiotic. There's an eye infection one for bacterial eye infection. What I do think is really good, the Ventolin. So that's salbutamol. So that's for someone having respiratory difficulty related to like a reactive airway disease like asthma, COPD, bronchitis, that kind of thing. Diphenhydramine is Benadryl. I don't think you need that. Reactin, the H2 histamines like Allegra, Allegra, Claritin. Those ones have really replaced Benadryl, where there it is. So I would leave that out. Tylenol, you can obviously buy anywhere. Naproxen, that's a pretty aggressive anti-inflammatory. So that'd be like stronger than your Advil, Motrin. You have to be cautious of your stomach on that one, but you could. Ondansetron, I would have liked that. I didn't get that in my kit. That's a really nice one for nausea. If Benadryl doesn't, or sorry, not Benadryl. If Gravol doesn't work, that's a fantastic drug. I didn't get it. My insurance must not have covered it, but that would have been a nice one to have. And then pantoprazole, that's a really good like anti-heartburn medication. And you could buy something similar like Zantac or something like that over the counter. So I don't know, for $400, I honestly would probably skip this one too, because you could buy the vast majority of things over the counter. And the other ones, it's like, I don't know if you'd really need those or not for the use case. Maybe this one, like, the ear drops and the eye drops that are antibacterial, nice. Definitely the Ventolin's nice. And actually, interestingly, so my kit, like I said, with the insurance, you get a variance of what you get. So these are the drugs. I got 2 bags of drugs with this one. I'll go through it. So Tylenol. That's your like GERD medication or like heartburn medication. There's a ton of it in there, probably more than I would carry, honestly. Naproxen, so that's your like pain med. Hydroxyzine. This is a prescription like Benadryl version. So they didn't even send me Benadryl. They sent me this. It is a really good antihistamine. It's just, I don't know if I would need to jump to that. Like I would probably find my over-the-counter antihistamines to be fine. They sent me Flovent. Flovent is not even listed on those medications. This is a steroid inhaler. So for, an asthma exacerbation or really bad chronic bronchitis, I don't know. I guess it's nice to have, but I don't know if I would need it. Ventolin, I like that one because that's so common to see asthma out there and people forget their meds. Oh, they did send me on Ondansetron. My apologies. There it is. So I like that one. That's a really good anti-nausea one. I think that's a great one to have. So there you go. That was kind of worth it. Anti-diarrheal, you can buy it over the counter. There's your antibiotic eye drop, antibiotic ear drop. So, okay. There is your constipation medication, but again, you can buy it over the counter. And here's your creams. So your kind of like antibiotic-ish cream. And then this one is an anti-itch cream. And again, I don't know, like you can buy polysporin, which is like maybe not as good, but a general kind of starting point. And you can buy hydrocortisone over the counter. So I would say, I don't know. It's a lot of money for what it is. But again, if you've got the insurance coverage, you're not paying for this as long as you're not burning your insurance coverage from something else you're going to want later. So just an interesting kind of website. These are a new thing that popped up. There are a few companies in the States that have been doing this for a while. And this is the first big one we're seeing marketed in Canada. I think if you're going to do it, be choosy. Pick and choose through it. Understand the use cases for this. I think there are definitely use cases for it. And it's not a terrible idea for those that think it's going to be helpful for you. If you're looking for more information, we have a link in the description below, and that actually links to the website, so you can purchase this kit or put it through your insurance, and we do get a small kickback for that as well. All right, thanks, crew. If you want any more first aid or medical stuff, we have that at wildmedkits.ca, and you can check us out online.